All right, today we're going to talk about a serious but often overlooked danger that pops up every single monsoon, especially in our cities. It's called leptospirosis, or as we're calling it, the urban flood fever. That sounds pretty dramatic, doesn't it? Almost like a movie tagline. But the scary part is, it perfectly captures how something so normal, like just walking through a waterlogged street, can turn into a major health crisis. So what exactly is this hidden danger we're talking about? Well, it's a threat that doesn't discriminate. It can affect anyone, whether you're an adult trying to get to work or a kid just playing outside. Let's get into it. Okay, so the name of the illness is leptospirosis. We're going to break down what it actually is, and more importantly, why it becomes such a massive problem every single time the rains hit. So how does this whole thing work? Well, it's actually surprisingly simple, and it all starts with rats. Their urine carries a nasty little bacteria called Leptospira. This bacteria gets into stagnant water, the puddles and flooded roads we see everywhere, and it can survive there for a long time. Then it can get into our bodies right through our skin, especially if we have little cuts, scrapes, or even just soft skin from being wet. But that brings up a really important question, right? If this is all about rainwater, why do we hear about it so much more in cities than we do in, say, villages or more rural areas? Well, it really all comes down to one word: drainage. See, out in the country, rainwater usually has somewhere to go. It flows away naturally. But in our crowded cities, poor drainage means that water just sits there, becoming the perfect breeding ground for this bacteria. You add in the high population, all the construction sites, and just more rats living closer to people, and you've got a recipe for a serious outbreak. Okay, knowing about the danger is one thing, but being able to recognize the symptoms, well, that's what can actually save a life. So let's go over exactly what you need to be looking out for. You really have to think of this illness as a ticking clock. For the first 1 to 3 days, the symptoms might just feel like a bad case of the flu, but that period between day 3 and day 5, that is an absolutely critical window. This is when things can go from bad to life-threatening really, really fast. So what are these early warning signs? We're talking about things that are super easy to just brush off. A fever, feeling totally exhausted, headaches, body aches. You might also notice your eyes getting kind of reddish, along with some vomiting or stomach pain. It's so easy to think, oh, it's just a bug. And that's exactly where the danger lies. Because if you ignore those early signs, after that initial window passes, the infection can escalate into a much more severe form, which is known as Weil's disease. And these are the red flags for a true medical emergency. We're talking about the eyes or skin turning yellow. That's jaundice. Urination slowing down a lot, or maybe even stopping completely. Trouble breathing, feeling confused, or any signs of bleeding. If you see these symptoms, it means that person needs to be in an ICU, no question. Now, I know all of that sounds absolutely terrifying, but here's the most important part, the good news. If it's caught in time, leptospirosis is very treatable. So let's look at how it's actually diagnosed and managed. To be sure it's leptospirosis, doctors have a few key tests. They might run a PCR test early on to actually find the bacteria's DNA, or use an antibody test like an ELISA to see how your immune system is responding. These tests give them the certainty they need to start exactly the right treatment. And this is the main takeaway right here. The treatment is straightforward. Common antibiotics like doxycycline or penicillin G are incredibly effective against this bacteria. If you catch it early, a person can be fully recovered in just about a week to 10 days. The key, as with everything else, is just acting fast. Okay, so you might be wondering, what are the specific signs that tell you it's time to get to a hospital, not just a local clinic? Here are the non-negotiables. If urination stops, if someone starts acting confused, if their oxygen levels are dropping, or if blood tests are showing a low platelet count or signs of bleeding, that's when you go to the hospital. Immediately. Of course, the best way to deal with all this is to just not get sick in the first place, right? And thankfully, protecting yourself from leptospirosis comes down to a few really simple common sense steps. I love this way of thinking about it. You can't always avoid the floodwater. That's just part of monsoon life. But what you can do is protect the main way the bacteria gets in, your feet. It really just boils down to these 3 simple rules. 1, protect your feet. If you have to walk through water, wear gumboots or at the very least, closed shoes. 2, if your clothes get soaked, change into something dry as soon as you possibly can. And 3, this is the most important one, if you develop a fever, have trouble breathing, or notice yellow eyes after you've been in floodwater, go see a doctor. Instantly. Don't wait for it to get better on its own. So, the next time you see those deep puddles all over the streets, just remember this. That stagnant water isn't just an inconvenience that gets your pants wet. It can be a real, serious health risk. Stay aware, stay dry when you can, and please, stay safe out there.